I am Michael McMillian, and I'm the Executive Director for Market and Network Services for the Cleveland Clinic in Ohio. I represent 2,700 physicians and scientists, a 1,000-bed hospital. We have a long history of caring for patients who travel from all 50 states in the United States, from 80 countries around the world. So we've been a part of the movement to seek the best medical care for a long time. We're particularly excited about the working with an innovative employer like Lowe's, and very pleased with the partnership we've had and the program we've been able to develop, and look forward to continuing to expand that. I'm here at the conference speaking about medical tourism and the unique program with the unique and innovative program that we've developed in conjunction with Lowe's. And that really affords an opportunity for Lowe's employees to travel to the Cleveland Clinic, where we believe they will have the best outcomes initially in heart surgery. As most people know, this organization has an outstanding reputation in delivering high-quality heart care. And this year we will do over 4,200 heart surgeries. And that is the largest program in the world. And so we believe that we have the experience and the depth and capability to offer every advantage to employees who are seeking high-quality heart care. So from our perspective, Lowe's put in a benefit design that really would make it easier for patients to make the choice to come to Cleveland. And we work with Lowe's to make sure that it's a good fit, patient's able to travel, it's an appropriate case to treat in Cleveland. And then from our point of view, we offer the very best resource in the provision of heart surgery. We have enormous depth. We have 16 heart surgeons, very specialized in all the aspects of delivering high-quality heart procedures. We have a long history. We have outstanding data about what procedures work, what things work in particular kinds of cases, what the best avenues for treatment are. And finally, our model really allows an employer to feel confident that a physician is making a decision based exactly on what's in the best interest of the patient. All of our physicians are salaried. And so there's no direct economic incentive for doing one thing or another for a patient except what's in the best interest of that patient. So our heart surgeons get paid if they don't get paid one additional dollar for doing more heart surgeries. And so they make a recommendation about what is in the best interest of the patient. We think that offers something unique to employers in the marketplace that isn't easily replicated. The other thing that's unique about our model is that physicians who work in the heart area work together. So the cardiologists, the heart surgeons, the vascular surgeons, the specialists in rehabilitation are all in one area working together in one management structure so that all the resources that are required to achieve the best outcome are together. And so a patient isn't in a fragmented, disjointed situation where you're traveling here to see this specialist and traveling over there. All the physicians are connected on an electronic medical record, so all the tests, all the information, the reports, the outcomes are all available to every physician who treats the patient. So they go to their computer and they can look up and have it immediately at their fingertips, the imaging, the lab reports, whatever they need to do an accurate diagnosis and perform whatever service is required. So let me tell you why what the salaried model means at the Cleveland Clinic. It's just a deeply held value that removing financial incentives from providing medical care is important. It's a value in the organization. So no employee is on any incentive, whether it's physician or non-physician. We have no incentive programs. The view is that what ought to be in the center focus is what's best for that patient. If that's surgery, that's what we do. If it isn't surgery, there's no reason to do something that's more expensive. We think that over time translates into higher quality, and ultimately higher quality we think translates into lower cost. The second thing that's important is the interaction between the members of the group, so that we have physicians who are uniquely specialized in various areas. They can all be brought together very quickly to address a patient issue, and so your colleagues in related areas can be marshaled to help a patient with a unique set of problems. And finally, we have a tradition and experience in taking care of very, very sick people. We have the highest case mix index in the United States for Medicare patients, meaning that we have the sickest patients in the country coming to our organization. So the area of expertise is really taking care of the very sickest people and getting the very best outcome that's possible. Well, like Bob, we've been speaking, so I haven't seen a lot of it. I did get a chance to go through the exhibition hall, so I was impressed with the breadth and the number of organizations and countries that are involved in medical tourism. So it seems like it's an area of great interest and opportunity. And we think for U.S. providers that competition is on a national basis, on a worldwide basis, and so that every physician and hospital needs to be able to compete with best in class for whatever services you're offering the community.